Hello, 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 everyone. Welcome on in to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And I am Nurse Charlene, everybody. And yes, so tonight we got us a nice little spicy topic. And it goes as follow. If you can see my board behind my head, that's what I'll be talking about. So the presentation is on sexually transmitted infections, used to be known as STDs, sexually transmitted diseases. And also with STIs is your risky behaviors and sex enhancing drugs. Are they good or are they not? And everything. So we're going to find out tonight because it's time to get spicy here and stuff. So welcome on in, you guys and stuff. I appreciate each and every one of you. And y'all come on and stuff, get me pumped up, get me ready to watch my own podcast and everything else and stuff. Definitely tonight is a good night. It's pretty hot and stuff, so people get pregnant in the heat or something too. So as I get people on, definitely I'll start up. Let me see. So I got one person on. Yes, and then all you have to do is Miss Rosie is turn it on now, and you should be able to hear and see and type me a couple questions and stuff. Make me feel like you think it's important and everything. Uh-oh, I seen somebody. Let me see. Oh, okay. There's Rosie and Brittany is on. And I thought I saw, oh yes. And Auntie Josie, she said, hello, everyone, checking in as always. Thank you so much, Auntie Josie, for joining the podcast. Shout out to Mama Rosie, Granny Allen, and she's here in the mix. And Brittany, True Diva Scott, she's on the line, on the hotline and everything, ready to get started with this stuff. And remember, when I do podcasts and I come up with these different topics and stuff, that doesn't necessarily mean that it's veered towards you or veered towards me. It's veered towards the human body. And that's what I'm trying to chop down one subject at a time. Sometimes I'll be in the mental health area. Sometimes I'll be in the first aid CPR area. Sometimes I'll be in the your gastrointestinal system, where how you poop and how you process foods, or I might do something on reproductive. It just depends on where the interest lies and everything. And I look at the ratings, and not ratings like that, but I look at, what are you interested in? Because then that means that I'm gonna keep on walking down that street. So when you see stuff, it's not always random. Some people ask, can you talk about this or can you talk about that? And that's why I, put certain subjects on. But other than that and stuff, we're all over. As long as there's a human body involved, anybody can get it, anybody can have it. So before I get started, in order to keep me on with no troubles and everything and in compliance, I'm going to read you my podcast disclaimer. And after that, we ready to go on in. I'm going to give definitions and everything. And again, I say, look at my board. I got a whole bunch of goodies on there. I was trying to draw my little heart out and stuff. I got some alcohol at the top and some pill bottles, some scissor, hypodermic needle. I got some weed, the leaf, and stuff that's representing weed and stuff. You got condoms. And they crossed out because, risky behavior means, just that. Cross out the condom and stuff. I got me some Coke in the bag, not Coca-Cola. But anyway, a blunt, and all types of stuff. So it's some goodies on there and stuff. Just, pay attention to that and stuff. Then over here, I got the names of some little brothers and sisters that we could come across, and stuff. If we're not doing things carefully and stuff, we could see one of these about something. And then I got body count. A lot of people that's, hip to the game, they know about the body count. That's how many people you got on down with. It doesn't matter if they boy or girl or boy or boy on boy or whatever it is and stuff. It's a body count. And that's what you're, piling up as you conquer everything and let everybody know that you fine or you pretty and stuff and all that good stuff. And I'm gonna just tell you that you could be pretty and still have the virus, the package, or something like that. So that's involved in everything. Welcome on in, cousin Antoinette. She said, "Hey, cuz, I'm here. I didn't forget today. Oh, that's my baby." Welcome on in and stuff. I'm gonna be talking about a little spicy subject and stuff. No pun intended, but it's sexually transmitted infections, are known as STDs, risky behavior, and sex enhancing drugs. Let's find out what's going on with that, because I told you I learn every time I teach you and everything. But I'm going to read my podcast disclaimer, and it goes as follows. Welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illness are broken down into simple, easy to understand conversations. This podcast is for educational and informational purposes only, while Nurse Charlene is a licensed registered nurse with extensive healthcare experience. The information shared here is not intended to replace professional medical advice, diagnosis, or treatment. Every person is different. What works for one individual may not be right for another. Always consult your doctor, nurse, practitioner, or qualified healthcare provider with any questions you may have regarding a medical condition or before making changes to your health, your medications, or your lifestyle. You got to consult with somebody that know about you, know your history. Okay. And if you think you may have a medical emergency, like right now, call 911. Get off this podcast and call 911, but also, or seek immediate medical attention. Take care of yourself so you can live to see another podcast. And I can live to see another. I'm going to call 911. I don't know about y'all, but maybe me. And, okay. No. Cousin Antoinette said, okay, in my Cardi B voice. That's the I know that's right. The views shared on this podcast are based on professional experience and general medical knowledge, presented in layman's terms to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. No provider-patient relationship is established, and you are responsible for your own healthcare decisions. I can't make them for you. I don't know how you live, just like you wouldn't try to make them for me. And remember, your body speaks. Your body's a snitch. Believe it. Listen to it, respect it, and when in doubt, check it out with a medical professional. Thank you for tuning in, you guys, and taking a step towards better understanding of your health. Okay, thank you. Welcome on in. Welcome on in, Auntie Rena. Yeah, she said, hello, hello, beautiful. Thank you, baby. Stuff, that's wonderful. And everything. So I got a little spicy subject, but it might go over some of us OG's head, but then again, just watch out. That's all I'm gonna say and stuff, because I'm gonna give you some ages that you still need to watch out for certain ones, and everything. But it's gonna be very interesting, and to actually know that us that got grandkids coming up and different things like that. And you don't have to have no grandkids. I'm just saying, or kids, nieces, nephews, and stuff, and they are these teenagers, and they going to prom and they thinking about things that they not supposed to think about, or we don't think they supposed to think about. They not mature yet, but they get on down anyway. And that's how you get teen pregnancies and everything else. So they found out, whether it was F around and find out or Faith around and find out, they found out and everything. So I'm gonna go ahead and get on in here, right? Okay, so we got sexually transmitted infections are infections spread primarily through sexual contact. They can affect anyone regardless of age, race, income, or relationship status. Whether you're married or not, you can get it. Okay. Important fact, more than half of sexually active people will get a STI at some point in their life. It's just facts. These are facts. Many STIs have no symptoms. They don't even snitch. You got to find out by being really intimate with yourself, because they whispering. They not snitching though. You gotta go with the flow. You know what you did last summer, so you got to go with that and stuff. And if something is itching and then it start burning, yeah, okay. I'm getting too far ahead of myself, but I'm just saying. So what is a STI? A STI is formerly is the new version of STD, sexually transmitted diseases. You got an STD, or you got a venereal disease. If you heard that, that's a really old word for it and stuff. But VD, venereal disease, or STD is now called STI. But it means the same thing, like homeless means is now unhoused. You're homeless, that means you don't have a home, so you're unhoused. Okay, so that's where we're going with that and stuff. So, cousin Tony said, yes, yes, yes. Okay, that's right. And everything. So a sexually transmitted infection is an infection passed from one person to another through vaginal sex, oral sex, anal sex, skin to skin contact, sharing needles, bodily fluids, but also needles, and that's bodily fluids and everything. And from mother to baby during pregnancy, or both, or at birth, and everything. So, couple little catchy things I want y'all to just pay attention to is burning when you pee. Your body's a snitch. You burning. You're supposed to be able to pee and feel relieved, not burn. If it's burning, something might be happening down there. You gotta check that out. That's your peace of mind down there and stuff. So you got to check that out. And the burning while you're peeing can happen to a man or a lady. So, everybody listen up. That unusual discharge isn't being dramatic. It's sending you a message. Discharge just coming out for no reason, but the fact that you know what you did last summer. I'm going to keep on saying that and stuff. That's where that comes in at. Okay. You did something this summer. Okay. You better stop it. I'm going to get you checked out. I'm going to check you out. Got some little dipsticks. Okay. A sore that won't heal may be whispering a secret infection, because it doesn't try to tell you all loud, like, hey, I'm here, because it want to stick around for a while so it can get all in your system. And then it's harder to fight it, and stuff like that. It's only whispering. Wait till it starts yelling. Your body talks before it screams. You better listen early. Okay. I want you to, by the time we get really into this, and get towards the end of the year and stuff, I want you guys to be all the way in on your body, because this is the only one we get. We don't get a body transplant, and stuff. The one you born in is the one you got to fix up, or the one you break down, but either way and stuff, let's get it done. Let's get ourselves together and everything. So no symptoms doesn't mean no infection. because they're silent. Okay. So sometimes they're not going to give you a clue. You got to figure it out. That means, like I said, everybody, well, I had a few people say something to me afterwards and stuff when I said, for women, we sit down on the toilet. But if you're just peeing, you don't never turn around and look at your pee to see what color it is, maybe, and stuff, because that can indicate maybe too many vitamins or, too much stuff going on and stuff. So it's different things that happen and stuff. So look at your pee, but also look at your turd. So, everybody sits down to poo-poo, and stuff like that. So look at that turd. Why do you have diarrhea? It's on. You just got to turn the volume up. Okay, sorry, y'all. Okay, I see. Welcome on in, Auntie Sandra. She said, good evening, Nurse Charlene, Rosie, and Britt. Sorry for the late doctor's appointment. That's all right. Guess what? You snitch because you go into the doctor and stuff. So you get a hall pass, definitely on that and stuff. So welcome on in, Sandra and T. Yes, welcome on in, ladies. So getting back to what are risky sexual behaviors. So I said sexually transmitted infections, and I gave you a definition. I'm not done yet. So now I want to give you what are risky sexual behaviors, because we all could have been a part of that too, and everything. You said, oh yes, cousin Tony said yes. I always look in the toilet. And Jesus, oh, wait, I didn't, it just skipped on me. Okay, yeah, I always look at the toilet when I'm done. Yes, just, it's not a weird thing, and you're not a crazy person. Remember, we said crazy ain't really a word, but a slang word. You're not crazy because you look back in the toilet. You find it out and stuff because one day it might have blood on it. That indicates something else. Either you got a hemorrhoid and one of them burst and left some blood on there, or it's dark and black and tarry, and that would indicate that you have some type of what they call a GI bleed, a gastrointestinal bleed. So it's a real reason behind just taking a peek at your poop. That's a real thing and stuff. As a matter of fact, it's so real that a beautiful lady that I love with all my heart looked at hers and said, she told me I got white dookie. It was cancer. So now do you want to start looking back at your poop? Yeah, you ain't crazy. But guess what? Cancer caught earlier than a normal person that just, oh, it's all right. Just take some Robitussin, take some so-and-so. And like I said, I joke around a little bit, but this is 911 worthy. This is serious, because if you don't pay attention, you could find yourself in the hospital and they don't know what you got because you ain't even able to tell them and everything, because the infection can get so bad. Welcome on in, Miss Rosetta Granny Allen, and she is watching. In Jesus' name, amen. Amen. Thank you for watching. Okay, so moving on to what are risky sexual behaviors. I'm going to get it out. Risky behaviors increase the chances of getting a STI that I just talked about. Okay. And examples. So it's not a big old thing, but examples of getting of a risky behavior. Having multiple sex partners. You looking good and tender, and you in your little in your prime for the men and your prime for the women. You looking good, hair done, nails done, everything done, and all of that stuff. And they all want you, and stuff. You gonna give everybody you. I'm just saying, and stuff. They all want you. You got to give it up, right? No. And stuff, you don't have to give it up. But I'm saying that it's that serious, just because you might have a lot of admirers, women, admiring the man, or what is it? Women admiring the man, or men admiring that woman. Yes, she look good and stuff, and she might look good for a while until she catch a little something, and then her face turn ghost white, and she don't look so attractive. but you already been in there. You know, you took a visit too, you know, and so, and vice versa for the women. You know, he looked good and stuff. He got the muscles and hey, you know, and all of that. He got the height or whatever and stuff, or the weight or whatever you like, whatever your style is and stuff. But guess what? If he likes to be an equal opportunity lender and he lends it out to this and that, and you know, she buying my car, she paying my car note, this one paying my rent, you know, this one always giving me money and stuff like that. Guess what? They can't all be yours. Because guess what? After a while, you know, you're going to fade around and find out. It's called a body count. So that was the first one. Having more than one partner puts you at risk for getting this STI. You popular, you know, and stuff. Sweet thing and stuff. Unprotected sex. She looked clean. She smelled good down there and stuff. Yeah, I went on in, you know, and stuff. He looked good. Everything smelled right and stuff. He keep himself up and everything. Yep, I let him get on down, you know. Yeah. Until he get on down, he leave you a little package, or she leave you a little package, and you start itching or something. I'm just saying, you know, care about yourself so much more and everything. So then that's unprotected sex. Another reason, example of a risky behavior would be having sex while under the influence of something. Alcohol and drugs impair your judgment. Another one is sharing needles. Okay, that one might go over your head, but it ain't gonna go over every single person's head that might see this podcast. And that would be you can spread HIV or hepatitis. That's the inflammation of your liver. Hepato, liver, itis is inflammation. See how I give you a little nursing terminology and everything. So hepatitis would be the inflammation of your liver. You don't want your liver to be inflamed because it leads to other things and it breaks it down. And that's your toxin filter. It cleans your blood and filters your blood. So you need that liver to be acting right, not wrong, because it's a whole bunch of trouble and everything. So then we have another risky behavior, starting sexual activity at a young age. Shoot, I've been getting down since I was, 4 years old. No, not 4, but like 8 or 9 or some 10. Okay, let's say 10 and stuff. Yeah, that's bad. I don't care how built you is and you little and you built, and stuff, because you got your daddy's genes and your mama's this big gene or something like that and stuff. That it still don't make no sense. That's too young. But we've had, adolescent pregnancies. When you're a child, you're not even, you're prepubescent, meaning before the periods for the girls. And before the boys even get their little testosterone up and stuff, they getting on down. And that's where teen pregnancy come in at. They want to do what mama and daddy was doing or what they heard last summer or this summer, probably this summer and stuff. But I'm just saying, so that's another one, starting at an early age. Another risky behavior is trading sex for money, drugs, and shelter. Another word for it possibly is the working girl, prostitution, or something like that. They're on drugs and everything. So then they have to sell parts, and give, Miss Brittany said, taking advantage. Yeah, taking advantage of you. They tell you cute and give you a couple little compliments. The next thing you know, you giving it up. It's still a treasure. Don't let nobody talk you out of that. It's still a treasure. And everything. So I'm saying that. And it does increase the exposure to infections, trading sex for money, drugs, or shelter. A house, a place to stay. Well, they give me a place to stay, so I got to give them what they need, and everything, or, vice versa. And then also the biggest one, and I don't know why they made it last, but another example of risky behavior is not getting tested. Do you know your status? And I'm not trying to, I'm not trying to sing the national anthem, but I'm saying, do you know your status? Because that will help you. You could get scared straight, and stuff by just finding out when you go get your tested, and you did a couple things here and there and stuff, but you don't have no symptoms or nothing like that and stuff. You get tested and it comes back. Or you think it in your mind, oh my God, what if it does come back this, or what if it does come back that, or something like that. That means that you was probably practicing some risky behavior. And that's why you would be nervous about the result, even though you don't get down all the time, and everything. So it's all those things. And sometimes beauty or handsomeness is also a curse, and everything. So just saying that, putting it out there. Okay. And drugs used to enhance sexual activity. Do you know they actually use drugs? And yes, okay, Viagra falls under there and stuff. But guess what happened to me? And it's a cute little story. I said, I'm a acute care nurse, a hospital bedside nurse. Okay, so one day I'm getting my medicine out this thing called the Pyxis and stuff. And I'm grabbing the medicine, and it was a lady, and it said Viagra. I was like, or slipping. It's some slip, whatever the other name for it, the drug name for it. But I was like, this is Viagra, and why am I giving it to a lady so she could? Yeah, she ain't gonna be in there trying to touch on me, and stuff. But it was actually for actual blood pressure, to bring down her blood pressure, because she had this thing called pulmonary hypertension, which is high blood pressure on the lungs and everything, which is a big deal and stuff. So we needed to bring it down. So for a man, it makes a certain thing rise. For a woman, it can correct your blood pressure and stuff like that. So you see, the drugs always have another hidden agenda. They might help you with depression, but they also can help you with anxiety and a couple other little things that you might have that the doctor didn't tell you about. So that's why it's good, when you go to Walgreens, CVS, or something like that, you pick up your medicine. That little paper is not there for just nothing and stuff. It's there so you can read it. And start reading the paper that they give you the medicine on, and you find out what your medicine is really for. Because sometimes it could be for an ear infection and your blood pressure, or it could be for diabetes and weight loss or something, and stuff. It got a couple dual, diagnosis and stuff for you and stuff. So you never know what they're really looking at when they assign you a medicine. Yes, cousin Tony said, wow, I didn't know that. Yeah, those little papers, sometimes you get sick of them. Like me, I would get sick of them because I already know what the medicine is. I passed a lot of stuff. I'm a glorified pill passer. I call myself drug dealer and stuff. I deal with drugs. I just don't charge you. It charge your insurance. But anyway, I'm saying that to say that this stuff is real. So just little food for thought. So drugs used to enhance sexual activity. Some substances are used to increase pleasure, confidence, or endurance. That means, keep you going long and strong or whatever, and can lead to dangerous behaviors. Number one on the list of dangerous things, alcohol. Bam, not alcohol. It tastes good. A pina colada, margarita, or what, a mudslide, or I don't know. I'm just saying. But anyway, and stuff. And it says, why do people use alcohol? Because it lowers inhibition. It lowers that nervousness. It makes you kind of brave. You rip your clothes off, and stuff, when you would normally be like, turn the light out, or something like that. I don't know. But anyway, and also it increases your confidence. Yeah, the man get him a nice little bit of gin in or whatever is clever and stuff. And then they like, yeah, all night long for us. Yeah. Okay. So the risk, you make poor decisions from alcohol. you practice unprotected sex. There can be sexual assault, like rape. Or, I said no. You didn't hear me say no. No, I was busy. I was gonna get mine. I don't know what you talking about exactly. Multiple partners, choo-choo train, run the train, or something like that can happen. Cousin Tony said, yeah, I do read that because I want to make sure I got the right medication. Absolutely. So yeah, you want to make sure you read it because it actually tells you what the pill is supposed to look like. So what if it says a white pill and a circular pill and they got a little box right there and stuff, and then you got some little caplets and they're blue and green? Yeah, you got the wrong medicine, because guess what? They human beings, so they can make a mistake. So that's what we were talking about, the pharmacy part of it, medication and stuff. So that's where that comes in. But this, alcohol was number one, and why they use it. It gives you confidence and all of that stuff. Poor decision making when under the influence of alcohol and drugs. Absolutely. Absolutely. And when you make a poor decision, you have to pay for it. So you see how I just, man, and stuff. But it's sex. It's supposed to be fun, right? Until it's not. Until we find out we got something. Okay. So also next is marijuana. What? They smoke weed and then they get on down. Oh, why do they use it? Because it relaxes you. It relaxes you down. You're not all scared and stuff. You be like, get this, or whatever and stuff. And then also because you get heightened sensations. Like, it's the best I ever had. Okay, it probably wasn't, but I don't remember anyway. So yeah, it was the best I ever had this time, or something. It happens and stuff. So because Tony said what? Yeah, been there, done that. And when you better do better. When you know to do better, do better. You got to do better and stuff. And so relaxation for weed and heightened sensations, it'd be a little extra. So you might lie a little extra and be like, oh, it's the best thing I didn't even know it feel like that. Yeah. Okay. I know that's like, but also the risk. Impaired judgment. That means you're not poor decision making, like Cousin Tony said. Forgetting protection. I'm high. We already doing it. So ain't no condom now. We already entered the kingdom of something and stuff. Granny Rosie Granny Allen said, well, said, help us, Lord, help us, because we be messing up. I'm just saying, be transparent. Y'all know what you did last summer or 3 summers ago and stuff. Cocaine is number 3. Where could you get cocaine at anyway? But anyway, okay, cocaine. And why people use it is increased energy. Make you go like a jackrabbit or something, I guess. And increased confidence. Now you Tarzan with a jackrabbit pelvis, so you bang, 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 bang and stuff. And the risk is aggressive behavior. Next thing you know, you choking somebody out and your hands around their throat, almost killing them or something like that and stuff. So that's probably a little special until somebody knock you upside the head with a pot. Like, slow your little tail down, like, this ain't fun. It's fun for you, not for me, or something. Or multiple sexual encounters. That means, everybody can get it. Everybody get a turn. I said choo-choo train and stuff. And also increased risk for HIV. Okay, I'm just saying, it's not always fun if you don't want one of them to get it and all the rest of them is right there too, and stuff. That's a special thing, and stuff. And I'm just saying, it don't end well. I watch all that special victims unit and ID channel and stuff. That's where that stuff be coming from. You think they just get it from making it up? No, it happened. to somebody somewhere, and then they made a whole TV show around it. Yes, and Auntie Sandra, Granny, Rosie Granny Allen said, my, yes, my. And then Auntie Sandra said, why do medication have so many side effects and make you not want to take them? Absolutely. So we've been through this and down this road a lot and stuff, because they give it to you for your blood pressure and stuff. I'm just saying, they give you a medicine for your blood pressure, and then it causes itching, or it causes your face to swell up. They call it angioedema, and stuff. So it causes your face to swell up. You get the nutty professor, big lips, big eyes, big nose, everything be swelling up on you and stuff. And it looked like you've been in 10 rounds with one of the best boxers, and everything, with no gloves on, just punching you and stuff. And that's because when they make the chemical, they making it to trigger this, and it might fix that, and then give you another problem over here. So now they got to give you another additional medicine to keep you from losing all your potassium when you pee, because you took this one and then that one and stuff. And then it's just a yo-yo game. And the more things that are wrong with you, and the later you wait and stuff, and now you're on the medicine for life because you waited too long to tell on it, but it was always snitching on you and stuff, then that's where it comes in as far as the medicine, the side effects. I cannot, and that's why I said before on a podcast that I said, name me a medicine, put it on here, and stuff. Just let me know and stuff, because there might be something out there, but name me one medicine that doesn't have a side effect. Even a 81 milligram baby aspirin that can stop a heart attack or help keep you alive during a heart attack has a risk of you bleeding. You see what I'm saying? So it's no matter what you take, it has a risk of something else and something else. And if you've ever, one more thing about that is, money, sorry to say. Oh, yeah. So Auntie Sandra said, money, sorry to say. It is it's money driven, because they get with the doctors and they go to these little conferences and stuff, and then they talk about their medicine and stuff, and then everybody is now on this medicine or that medicine or this drug or something like that, and you're like, why did they pick that one? Why did they pick Moderna and they didn't pick Johnson & Johnson or Pfizer? Or why did they do this? Or why did they do that? That's where that comes from. And Brittany said, crack and fentanyl. Yeah, that's really getting on down there, Miss Brittany. But yeah, you're right. Those are some really bad boys and stuff. Crack and fentanyl. And then Auntie Josie said, my lips did swell up on the medication I took and have to stay in the hospital for 3 days. Yes, it's called it's a thing called angioedema, which means that edema is the swelling, and the filling up of fluids. And then you gotta like put ice packs and different things, ice followed by heat and ice and stuff to try to make that stuff go down. But also they end up having to give you some type of Benadryl, or if you're allergic to Benadryl, they got another kind of IV medicine you can take and stuff that they'll administer to you to take you out of some type of either sensitivity or this other one that's deadly, anaphylaxis. That's when you just shut down. It shuts your throat down and everything. You are 911 worthy. You're about to die. They might even have to put a trachea, that thing in your little hole in your neck and stuff, and stick it on down in there, because everything is swelled up and everything. So it's very dangerous. Medicine in general. But sometimes they'll give it to us. But who did they test before giving you that medicine? Did they test 100 African Americans, or did they test 100 Caucasians or Asian Americans, Latino Americans? Who did they test to let you know that this is the safest drug to do? Because different ethnicities, it works differently on you, different parts of the world. Like two people could African American and a Asian American can be in a different part, grow up in a different part of the world, period. And so it's different ways of looking at that, whereas where you're from, the food you eat and all of that stuff, your allergy intake, like, are you allergic? Like how somebody can be allergic to peanuts. Well, it's actually really true, and stuff. We got gluten-free stuff, because if you eat the regular stuff that has gluten in it, it could kill you, eventually and stuff. So all of that stuff comes out, in the wash and stuff. So yes, it's just pay attention, because some medicine to help you shouldn't make you sick, should make you fall over dizzy, like, you're drunk or something like that and stuff. It shouldn't do that, but it definitely can. And sometimes you have no choice but to get that type of medicine. So moving on to other things that other medications or drugs and stuff that you can have that will cause you to have risky behavior would be like your methamphetamines or meth, crystal meth. And that why people use it increases sexual pleasure. Wow. I don't think the meth people knew that when, that it will increase sexual behavior and stuff. But meth, ain't nobody gonna all get out and stuff and try to go, try that and stuff. You have to have already graduated from a gateway drug, which means the start of your whole spiral into deeper drugs, but increases sexual pleasure and also longer sexual activity, meaning they can stay up for a long time, and that's the risk is extremely high sexually transmitted infection risk. And then also multiple partners, because it's your sex drive so high, you wear out this one, you go and grab you another one and grab you another one, and it doesn't matter, a human being and everything. Poor decision making, of course, and then increased HIV transmission. That's bad. That's really bad and everything. And that's for crystal meth. But guess what it do, y'all? It increases sexual pleasure. Ain't that why you do it? Because it increases the pleasure when you get on down. Hey, I had me some good stuff, yeah. and you found out you got your little package when you finished. Okay. So then what else? I said increase HIV transmission. Also, you got ecstasy. I know we remember that ecstasy, Molly, all of that type of stuff and everything. And why does people use it? Because it increases that sensation for intimacy. Oh, they just touched me on my arm and my whole body just started wiggling, or something like that. And yeah, while you on that drug. But what if you found out who you really did it to when you wake up out of that daze or something? It might be a little special for you. You're going to find out. But anyway, it enhances the sensation. So just stroking your hair or something like that, it can, cause you to have a possible orgasm, and stuff. It's that that's why they take it. Especially the college kids, you're already scared. You ain't had many pleasures in your life and everything. You in college, you see these, these beautiful women and stuff, that haven't been ran through and stuff. You see these beautiful men that hopefully haven't been ran through and stuff. And then y'all hook up, link up and stuff, and y'all take a little drug and stuff. And then the ones that don't get none and stuff, they get on in there and to the party when y'all do the choo-choo train and stuff. And everything. So then you got risk. With ecstasy, the risk is dehydration, definitely unsafe sex, and also memory lapses. I don't even remember who I did it to. Did I do it to a boy or a girl, or both, or a few boys and a few girls? Because everything was fun, and I don't remember, but they told me I had some fun. and everything hurt like it's gonna fall off of me now. I'm down off the drug. Yeah, it's special and stuff. Treat yourself better. It's another one called poppers or amyl nitrate. And it's why people use it, because it's a relaxation of your muscles and an enhanced sexual experience, which means it gives you a little pleasure, So even if it wasn't that good, it was good, and stuff, because you're on that drug. And the risk is dizziness, low blood pressure, and increased risky sexual behaviors. That means, okay, put it in my eye, put it in my ear or something. Just try it out and let's see what happens and stuff. Yeah, don't put it in the eye and the ear and stuff. Yeah, it's a couple places you can put it, but yeah, come on, be good, please, and stuff. So then we got another one that nobody, really pays attention to, but it's called ED, erectile dysfunction, and this is for the male subject, and it's medication for that. And one is called Viagra and the blue pills, and then one is called Cialis. They kind of pretty much play off the same thing. These are examples of erectile dysfunction drugs and everything. So then the risk is it's used recreationally. Pop me a couple of them blue pills and I go at it, and then your heart stop. But anyway, and it can encourage prolonged sexual activity and multiple partners when misused. Yep, it's still up. So bye, Miss California. Let me go get me another one in Miss Nevada or something like that. That's where that comes in at. I'm just saying. I'm just trying to be as real as possible. Thank you, Brittany. She said, digging in the butterfly. What did that mean? I'm going to get you. Okay. But anyway, some of the most common STIs. Now we're getting down to the end, and stuff. Most common STIs. I'm a whiz on through this, but y'all stay with me. This is some real stuff. And even if it doesn't go down your street and deliver into your mailbox, you got family members, teens and adolescents. You got older folks and stuff that they be getting down too. Don't let the smooth taste fool you and stuff. I don't care if I got a cane, as long as I can whip it, and stuff like that. They get down too and stuff. So the most common sexually transmitted infections, STDs, venereal disease and stuff, is the first one. You will be shocked, but yes. It's called HPV, human papilloma virus. Oh, look at that. She pronounced that. I can't even pronounce, what is it? Viagra's medical name and stuff, but that's all right. HPV. And this one, you'll find this around the teens and stuff. That's why they want them to have that HPV vaccine and stuff so that they can protect themselves against this, because it turns into cancer after it's not and it's not treated. And she's cousin Tony said, would you say, come on, cuz, teach us knowledge is power. Bring it. All right. You said bring it. Well, I'm gonna bring it, cuz, and stuff. And so HPV, and that one is a viral infection spread through skin to skin contact. They didn't say intercourse, they said skin to skin contact. Them locker rooms that oh my goodness. But okay. So the symptom, genital warts. So, if a guy got that, you got to watch out. You got to be cool about that and stuff. But also sometimes you have no symptoms. It's not burning, it's not itching. So you don't know. So guess what you got to do? Try to inspect that part. Look at your trigger. Look at your pistol, and everything. I'm trying to be nice about it. You want me to say DI? But anyway, and also certain strands can cause cancer. That's what I'm talking about. That's why they want you to one less. That's why they be going off about it and stuff, is because one of them can cause cancer, certain strains of human papilloma virus. And then the treatment. There's no cure for a virus. Why you think HIV still be like, hey, y'all want me? Let me know. Yeah. But anyway, I'm saying that to say that there's no cure for a virus. And warts can be treated. They have certain medicine that they can take the wart off, and everything. So that part can be treated. But just imagine if somebody's going inside your daughter, your son, or however that works and stuff like that, and they got one of them and don't even know it's a wart on their, their special, area and stuff. And that's where that comes in at. It's like, it's really serious. You got to teach them not only to look back at their peep and look back at their poop. Like men got it easier. They stand up and let loose into the toilet and stuff. So you get to look at your stream, because you need to make sure that it ain't a prostate problem, but also what color your pee is coming out. Do you need to drink some more water? Is it golden showers? Golden ain't cute and stuff. What's cute about golden pee? It's dehydration. So anybody told you that that's cute and stuff, they lied to you. They lied a lot to you and everything. But like I said, so there's no cure for the virus, and it's a human papilloma virus. Warts can be treated, and the vaccine helps prevent the infection in the first place. So there's a vaccine to stop it and everything. And Auntie Sandra said, what is STI versus STD, and how are they transmitted? So STI means sexually transmitted infection, and STD means sexually transmitted disease. They're the same thing. And I did say it earlier and stuff, but just because that was brought up, and that was a good question, because it's just like saying, ooh, that homeless person, they get on my nerves. Guess what the new word is? Like STI is for STD. STD was first and stuff. So now it's not homeless person. It's unhoused person. You see what I'm saying? They want you to correct it. There's no longer, oh, they're mentally retarded. They retarded as hell, or something like that. No, it's called intellectual delay. So they got different names for them. As we come into our 21st century and everything, that's where this is coming from and stuff. So definitely something to think about and stuff. Very good question. Thank you and stuff. So I told you about the human papilloma virus. So I'm going to try to run through the rest of these and stuff. And that is and how they're transmitted through vaginal, oral, anal, sex, needles, sharing hypodermic needles, with drugs in them and stuff. And then also that risky behavior. So all of that's involved in everything. So thank you you said thank you, but thank you for that question, because that's how we get to think about it, because somebody else probably wanted to ask that or wanted to inquire about that. And you brought it up. So thank you very much. And everything. So another most common STIs or STDs, either one and stuff, is chlamydia, the clap, they call it. And it's a bacterial infection and one of the most common STIs. And the symptoms are pain with urination, discharge, pelvic pain. It start burning the whole pelvis and everything, especially on a woman. That's the pelvic pain. And then sometimes often no symptoms. If you already zip through those and they whisper lowly and stuff until they come springing back out at you, because just because you leave them alone and they didn't get you, you must didn't get me that bad. They got you that bad. If you got it, you got it and everything. And the treatment is antibiotics because it's bacterial. Viral, no antibiotics. Antibiotics for it, but bacterial, there's antibiotics for it. And hopefully that'll be just enough, unless you go back out and touch the same person, again, with the actual infection. The number 3 is this one. It's called gonorrhea. Yeah. And its symptoms are burning during urination, yellow discharge, yellow to green colored discharge, pelvic pain. That means where your bladder sits, that pubic area, where your pubic hairs are and stuff like that. That's your pelvic area. So it's pelvic pain in that area. That's where you'll feel a sharpness and pain down there, and even a sore throat. And the treatment is antibiotics. Okay. Then you have number 4, which is herpes simplex virus, or HSV. And the symptoms are painful blisters, and it's tingling and burning. They're very painful, and you'll know because it screams loudly. It never just be quiet unless it's not outbreaking at the time. And the treatment is an antiviral medication. Now, I said that there's no antibiotics to kill a virus, but they have some antivirals that can stun them, and everything. So it is a such thing as an antiviral. That's what you take for HIV/AIDS, and everything. Because there's no cure, they got things that will touch it and challenge it. And that's the antiviral medication. There is no cure. Okay. Number 5, syphilis. And syphilis got a few stages because they want to be fancy. It's bad and bougie. And they got the stages of stage 1 is a painless sore. Stage 2 is a rash on your hands and feet. It ain't on my little part down there. It's on my hands and feet. Yes. Stage 3 is organ damage from syphilis. Yes. Tuskegee Airmen and stuff. Yes. It can damage your organ, and it can give you brain damage. Syphilis is not playing. So it would behoove you to get to know your body so that you know when it's whispering before it starts screaming and you got brain damage or organ damage. If it break down one of your organs start shutting down, guess what? You get to die. Yes. And with early onset or early treatment of antibiotics, you could get away from that and decrease that risk on yourself. Thank you for my hearts. I be seeing them, y'all. Not on the screen, but on my phone that I'll be looking at and stuff. Thank you very much. And then number 6 is HIV, human immunodeficiency virus, HIV, which leads to AIDS, which is AIDS and everything. So with that being said, this is a virus that attacks the immune system. We need our immune system. That's how we fight off a cold. That's how we fight off germs and infections and everything. Our immune system goes and fights for us. But what happens when the hell get beat out of them? Yeah. Then you're compromised and stuff, or something happens and you get something removed that helps you fight things and stuff. Then you have to fight harder. You have to get more injections of certain things and stuff to keep your immune system up, or to just drop and bottom out, and you'll have a flower can get you an infection and kill you, and stuff. It's that bad. So this is a big deal. And so, like I said, it's HIV is the virus that it attacks the immune system, and it gives you flu-like illness. Oh, I just got a cold. I probably just got pneumonia or something, or bronchitis or something. Yeah, or HIV is or something. And significant weight loss. And it's not because of something that happened or something like that, but a real weight loss. Night sweats, recurrent infections, because your immune system been challenged. So it's gonna break that down and stuff. It's a bad thing. That's terrible, and everything. So then the treatment, antiretroviral medication. Ooh, that was a big old name. It's basically saying stuff to go beat it up and stuff. That's what it's trying to do. It's trying to go to the source and try to attack it anyway and everything. But you got to take it in pill form. because your immune system already got whooped, and everything. But also, there's no cure, but people can live long, healthy lives with it. Magic Johnson, he was diagnosed and he went on and spoke his truth. And look at him, still there, on about 900,000 movie theaters. He's a baller and everything. He was a basketballer and stuff, yeah, probably fine and tender, and stuff. He got a beautiful wife and everything, but he got on down and, he took them little challenges and everything. He fine. He a basketball player. He got all the little muscles and everything, nice and tall and dark and handsome and everything. But it went into everything. His part went into people, probably beautiful women, and guess what? They got it too, and stuff. So I'm just saying, he might have came out and said him, but what about them ones that was like, oh, I got on there. I think I might have had his baby, Or I'm just saying, she was probably cute, but anyway. So then number 7. Trichomonas. And a lot of people sleep on this one and stuff, but trichomonas is also a sexually transmitted infection. And the symptoms are itching, odor coming from your part, man or woman, whoever having the sex together, and stuff, and has that, that infection and stuff, discharge and burning. If you burning, that should be enough to cause a discomfort, and everything. So definitely that's something to think about and stuff. But guess what? They got antibiotics because it's bacteria and bacterial in nature. So it means that it's a bacterial formed infection and stuff. So it has antibiotics that kill, anti meaning away from the biotics, which is the bacterial. So it's gonna attack, it's gonna get it. And guess what? This is 100% real. And guess who could get it? Anybody at any age. I'm just saying. And I said the antibiotics. And then there's other sexually transmitted diseases. I'm just gonna run off the names, just so you'll know. And that's hepatitis B. Hepatitis B. So inflammation of my liver, part B. Inflammation of my liver, part C, hepatitis C. There's another one that people don't talk about, but it's there. Welcome on in, Papa. Raymond Buckner, my dad. He didn't came on. All right. And stuff. But another thing that is definitely out there, and stuff. Don't get it wrong and stuff. Pubic lice. You can pass the little monsters, and they bridge, and I guess they go hair to hair or something like that and stuff. But they get on down. They still around chilling, and they cause a lot of trouble, and they're very contagious. And you get them on you and stuff, and then you got your little kid playing in your lap. Next thing you know, they might have some in their hair or something like that because they own you in that area, or the mama or whatever. It's a mess. And then just in general, signs and symptoms of a STI, sexually transmitted infection. Your body may be snitching if you have burning during urination. Listen close, because it might not be for you. Somebody might say, I got this going on and stuff, and then I know what that is and everything and stuff. But burning during urination, unusual discharge, not just your regular, mucus that you might have, from time to time. This is some unusual, and it's usually heavy. Like for a woman, it would be like heavy as your period, and stuff. You're going to know something ain't right because it's not a period. It's something else going on. And then genital sores. When they say genital, they're referring to your private area, your vaginal area, your penile area and stuff. So genital sores on it. You'll know because they hurt. Itching. I always say that you're gonna be itching and stuff. I don't know why I'm in love with itching. I'm not in love with itching down there, but I'm saying I just like to say you're gonna be itching, and stuff. But also a rash. Rashes don't pop out of nowhere. You could get a heat rash or something like that. Don't think, oh no, I got a STI, no, and stuff. But it will behoove you, where is that rash at? And that's the key. And then you got what else? Pelvic pain. So I said where your pubic hairs is, you know, the part you hide on a bikini and stuff, or shave off the, and stuff. Man or woman, you got that down there, little hairs and stuff like that. It's in that area behind the hairs, where your bladder is, if you know where your bladder is and stuff. I'm trying to keep it in layman's terms and stuff. Pain during sex. That's probably, if it was fun all the other times, and then this time it hurt and it's burning or something, it's probably you gonna probably find out something. There's a good chance. Go ahead and tell on it, because if you tell on it early, guess what? You get to get mostly the cure and stuff. It's a couple things that you can't get cured, but you can at least get them settled down. And now and everything. You won't go back to that person or this person or whatever. And then bleeding between periods. That's for the women and everything and stuff. So unusual extra period or something like that, get it checked out. Just get it checked out. I shouldn't have 2 periods a month. It's 1 and done, not 2 and 3 or something like that, or some weird stuff. And then swollen lymph nodes. Well, lymph nodes is a part of your immune system. So if your lymph nodes are swollen, it's saying, hey, we got an infection here. That's why the doctors always feel on your neck, and they feel in these little areas behind your ear. You could trace yourself, go to your ear and go behind your ear where your earring would go and stuff, and then go down and trace under there and stuff. That's where a lot of your lymph nodes are located, but they're under your arms. They're all over your body. And when they swell up, something is wrong. You're already in the middle of the mix, and everything. So that's what swollen lymph nodes mean. And then a fever. You don't get a fever for nothing at all. And you don't have a fever just because you're out in the sun and it burnt the hell out of you and stuff like that. When you get a fever, it's because it's indicating there's an infection somewhere. Your white blood cells just went over here to your lower leg, or they went over here to your arm, and you just got a shot and stuff. So they over there. So you might get a fever with the vaccine. It's not a sexually transmitted infection. But if you got down this summer and everything and stuff, then that's probably something that you need to check, especially if you don't remember, or if you did it without any protection. He looked so good. I just said, okay. No. Yeah, no. But anyway, and remember, no symptoms doesn't mean that you have no infection, because some of them hide. So you got to be the investigator, because they're going to leave a clue. They ain't going to scream at you, but they'll leave a clue. So just pay attention to that. That's all I'm saying. And then age groups. So I'm going to just run through these real quick and stuff. And ages 15 to 24 is the highest rates of chlamydia and gonorrhea. 15. Oh, she doing it now? I'm just saying, 15 to 24. Watch out. And the reason is multiple partners, inconsistent condom use, and lack of education. They don't know what they're doing, but they know that their parents did it or something. Mom got a boyfriend, dad got a girlfriend or something going down and everything. Ages 25 to 44. The risk are dating apps, multiple relationships, and substance use disorder and everything. That's drinking or drugging, popping them mollies and going to the club, letting everybody get inside, or poking everybody, and everything, however that go. And then you got ages 45 and older. Their risk are new relationships after divorce or widowhood, and less condom use because pregnancy isn't a concern. But pregnancy ain't the only thing. Is HIV still hanging out there like, hey, y'all want to get it now? I know you didn't want it back then. You was pretty good and stuff. You want it now? Okay. And stuff. And then the less condom because I ain't gonna get pregnant. I'm already old or whatever and stuff. Yeah, but you could catch something else. You're gonna be burning, you're gonna be itching. Yep. And stuff. So then we got complications if you don't treat the infection, the STD, STI, sexually transmitted infection or disease and stuff. Then for women, it's infertility. They can't get pregnant. They can't reproduce if they have an untreated infection. Ectopic pregnancy. That's another one. It's not the catch all, the end all, but it's a possibility. Pelvic inflammatory disease. Remember, I told you the pelvic is where your bladder is, or behind your pubic hairs and stuff. You know, that one. Or chronic pain, just chronic pain. And that's for a woman if untreated sexually transmitted infections aren't caught. For men is infertility. They can't make babies. You know, they can't make babies. That's just period. Or prostate infections. You need your prostate in working order. And the way you check that is a man is privy to stand up and pee. You know, that stream will cut off and the stream will go down to a drip instead of just, you know, pointing and shooting and stuff like that. So it's a real thing that, you know, take care of, you know, and stuff, or pay attention to. And also testicular, referring to the man's ball sack. Yeah. Is that too gritty for you? Well, your balls. I don't care. Your scrotum, your balls. Okay, and stuff. And that's for a man. And then for both people, guess what? Cancer. So it makes you, you know, these are risk. If untreated, you can get cancer, like cervical cancer for women and stuff like that, but also prostate cancer and different things like that and stuff for untreated STDs, STI. Organ damage. It can jack your kidneys up. Next thing you know, you getting dialysis if you make it to that, you know, and everything. And then other things that can happen to you, you know, start shutting down stuff. You can't shut down the lungs because then you can't breathe, so you unalive already. You can't stop the heart because you only get one heart and stuff. If that stopped, you're already dead, you know, and so on and so forth. And in severe cases of untreated sexually transmitted infections, there is death. So guess what? Is this 911 worthy? Well, that's what we speak it on and stuff. So yes, it is. How to prevent STI, STD, or whatever else. Abstinence. Refrain from having sex. That's not always possible. So guess what? Okay, you got to do it. No matter what, you don't have the moral compass or whatever stuff. It's okay. No judgment here. But guess what? If you can't be abstinent and not give it up, you know, or something like that and stuff, that happens, you know, or you think about it, you can't stop thinking about it, so you got to do it or something like that. At least protect yourself and protect the person that you went ahead and gave it up to, you know, and stuff. Protect them for themselves. Go ahead and have that barrier. But also, it says mutual monogamy. That means you and the person, usually in a marriage, you expect to be mutual monogamous. That means only my husband, only my wife. You know, we know that doesn't always happen that way and everything and stuff. But I'm saying you agree to that and stuff. So that's a way to prevent STIs from hanging out with y'all, you know, married folks and everything. Then there's condoms. Actually using them and stuff, because that's the only real barrier. You can have birth control pills, but guess what? If they stick it in, they still giving you whatever is on that. Okay, you know what I'm saying. You have sex without condoms, it's straight raw. That's what they used to call it, raw or whatever and stuff, which means that you could get it, you can get it, you can get it. Okay. And then you have vaccines, the HPV for human papilloma virus, and you have a hepatitis B vaccine that you can get. Oh, I don't take no vaccine. Okay. Then you have to find out the other way and stuff, unless you are just allergic or have some type of underlying thing where you can't have the vaccine, Guillain-Barré disease or something like that and stuff. But if there's nothing else stopping you except for the fact that you said, I just got me a hepatitis vaccine and now I got hepatitis. Yeah, you didn't have hepatitis before because they actually test you and they do this thing called a titer and stuff, and they check to see if you even have the antibodies. If you don't have the antibodies, then you need to get the vaccine so you can develop the antibodies and stuff. So it's not about that, because I ain't taking no COVID. They're gonna make my head spin and fall off and stuff. Well, getting AIDS will probably make your head spin and fall off too, fall off into that grave, and stuff. So I mean, it's up to you and stuff, because everything is your decision. And at the end of the day and stuff, avoid sex while intoxicated, avoid sharing needles, get regular tested. Even if you don't feel nothing, they're silent. A lot of them are silent before they roar, and stuff like that. So get tested. It doesn't hurt, and then also honest communication with your partners. Yeah, you got to tell them. Yeah. I got a little song. It's called The Package. And then R. Kelly said right. Yeah, nobody like R. Kelly. But anyway, and stuff. He said it right, though. He said the package. Okay. And stuff. What Rosie Granny Allen says. Love the board. Well said in this podcast. In Jesus' name, amen. Love mommy. I love you too, Rosie. But yes, she talking about my board because I took the time out to put a body count. Women, I got about 70 or more and stuff. And the men, I got about 170 or more, and stuff like that. And that's what body count means. How many people you slept with, different people you slept with. That's a part of your little body count, and stuff. Just remember that. And there's a lot of ties to that. I'm not going to go into it tonight, but yes, and stuff. It gets special and everything. So as I'm ending, I want to give you this warning notice and then take home message in conclusion. And that is when to seek medical attention. Seek care immediately if you have genital sores, severe pelvic pain, fever and with discharge. That's an infection, I'm telling you. Painful urination, exposure to infected partner, sexual assault or rape or something, and it could be the man getting raped or the woman. So it's the human being. And positive home STI test. They have home tests that you can check and see, do I got this one or do I got that one? It tests for this and stuff, and that's where it come in at and everything. Oh my God. You see it? Josie said, Mildred said, don't talk about her R. Kelly. I know, because he got a little song. I'll be jamming to it and stuff. Yeah, he messed up. He got to do his time and everything and stuff. But he's still a little tenderoni too and stuff. But yeah, he did some things that he ain't proud of and everything and stuff. But that boy got some music. It's cold. I don't care. I'll be listening to it. I don't agree with what he did, and stuff, but I still listen to the music. Don't mess with the music. So I agree. I'm in solidarity, Miss Mildred and stuff. Miss Michelle, how you doing? She said, happy Tuesday. Happy Tuesday to you, Michelle. Thank you for coming on and have a good evening also. Yes, and don't forget, even if you came on later on in the podcast or you've been on and stuff, it's okay. You can always, and everybody, even if you've been on from the start, you can watch the replay. It's available about 3 to 5 minutes after I get off the live. And I'll be finishing up right now and stuff. So I'll have you guys out of here in just a couple more minutes. And the take home message: protect your body. That's the main thing. I can't be more serious about that. Protect your body. Okay. Get tested. Know your status. Know your HIV status. Know it and stuff. It's okay. Communicate with your partners. If you got this ongoing partner, you guys aren't married, but you get down, friends with benefits, whatever and stuff. Know them and know you, because every time you sleep with that person with no protection, you're sleeping with everybody they didn't slept with. And one of them might have something, the package and everything and stuff. Same thing with everything you do and stuff. You got to communicate also with them and stuff. And y'all got to be real. Y'all got to be, solid ground on this and stuff, because it doesn't end well for none of us and everything. And avoid drugs and alcohol that impair your judgment. But I be staying up all night long and stuff. Yeah, nobody want to go all night long. Not if they in their real mind and stuff, unless that's the last time they're going to do it to you and stuff. And so y'all going to just go all night long. Okay, what is it? Lionel Richie had all night long? Okay, all night long. But okay, maybe an hour. But yeah, all night long. Come on. But anyway, use protection. Come on. Find something. Even if it hurts and stuff, find something, some type of the right condoms. Take your time, shop around, get you a lot of them, so that when you go out and you get on down, you always carrying, and everything. And seek treatment early. Don't wait. I'll just take some Robitussin. Robitussin don't cure it all. Try some Vicks down there if you want to. No, don't do Vicks. That's like drinking bleach, like that president dude said. And stuff. Your body whispers before it screams. Listen to the snitch. Your body is a snitch. Listen to it. Believe it. Okay. So powerful conclusion. I'm going to let y'all go in just a minute. And that is, sexual health is a part of overall health. STIs, or sexually transmitted infections, do not discriminate. They can affect anyone at any age if you're doing it. The good news is that most infections are preventable, treatable, and manageable when caught early and everything, because sometimes they'll go away, the symptoms, but you still got it inside. You didn't fix it, and everything. So that's what I'm saying. Silence doesn't mean safety. Some infections make no noise at all. They don't even tell. They just give you a little breadcrumb. And if you don't like bread, then you ain't going to pick it up. And last but not least, your body's a snitch. Believe it. When something doesn't feel right, don't ignore it. Get checked. Get treated and protect yourself and others. Okay? That was so hard trying to keep from saying dick and pussy, but okay. And so I'm just saying, I'm being real about it and stuff, but this is some real stuff, and we can die if we don't do the right thing. And, yes, it was fun at a time and stuff. I've been there, did that and everything too and stuff. So I'm not no little angel coming here, but I'll tell you one thing. It opened my eyes, and just knowing my status and things like that and stuff, it really does help you, and it helps you to refrain from certain things. Yeah, I don't want to die. I don't want to drink and drive, because I could kill somebody else, but then I could kill myself also and mess up and ruin my whole life. So at the end of the day, you guys, treat yourself good, give yourself some grace, and know that your body is a temple. Your temple that God has made, and you just gotta get it checked out, even if it hurts. I gotta get it checked out, even if it hurts, even if I don't want to, because I'm telling you, but I gotta tell myself too. So when I'm teaching you, I'm teaching me again, over and over and stuff. So I say that you guys, just pay attention and everything, and value yourself more. And like I said, You might not have anything on this paper, and that's okay. But guess what? You still got a family member that's not in the know. You still got this person and that person and stuff, and people that you love, and you got teenagers and stuff coming up in your family and stuff. If you love them, you'll show them. You'll give them that little, let me give you some game here. Yeah, it's okay. You fine as hell, and stuff. And I could see them liking you, and stuff. I got 2 grandsons. Woo-hoo. Them is some tenderonis. Woo, woo, and stuff. My baby boys and stuff. But at the same time, Granny gonna be right up in there. Ooh, she like you? Well, just in case, I'm be on it and stuff. I'm be hiding in the bushes. I'm be hiding under the stairs at they little prom and stuff. Because I got twin grandsons, and I'm telling you, these boys, oh my God, they're so handsome, and stuff. Good job, y'all. But anyway, saying all of that to say that when it's all said and done, just, treasure you, but treasure even your loved ones even more and stuff. They need help. People are not in the know and stuff. And that's why I do it, because I need to get you into the know and stuff. And it's going to be a whole lot more procedures happening and different things. You're going to be getting all your stuff checked out. You ain't going to be playing. You get in that doctor's office, it's going to count. It's not going to be, he just talked over my head. I don't even know what I got, and so, no, you shouldn't leave that office unless you know everything that you got, and stuff, or what they know. You need to know it too. And everything and stuff. Thank you guys and stuff. And thank you for hanging in there with me and stuff. But I needed to get this out because there's certain things that we got to know. We got to know, or we just going to fall for everything. We're going to die. We're going to die if we don't get this information in. It got to stick somehow. So watch that replay. It is streaming from right now until I get off and turn it off and stuff. It's streaming from YouTube, Medical Talk and Layman's Terms with Nurse Charlene. That's how you find it. And then it's streaming from Facebook Live. And I have a public, I made my platform public, and it's Charlene Nurse Allen. And yes, you can find me either way. And just have a look on a Tuesday at 7 p.m. because I'll be here unless I have something that, unexpected things that happen and stuff, but I'll be here and everything. Be in a know. Knowledge is power. It is power. Your health is your wealth. It's more than $1 million, because you could be dying and got $1 million, or you could be healthy and have just enough to get you by and everything. So thank you for listening, you guys and stuff, to another installment of Medical Talk in Layman's Terms with Nurse Charlene. And yes, this is your girl, Nurse Charlene. And I care about every single topic that I give to you and everything. And I want you to do right and do right by yourself and everything. Michelle said, good evening, everybody. Rosie Granny Allen said, say that. Will said, amen. Thank you, mommy. And Auntie Rena said, amen. That's right. And Dad said good night and stuff. Go on and get you some sleep and stuff. All right, you guys and stuff. Take care and take care of each other. Okay. Thank you.